All right, Kristi Leigh here. It is losing count of the days here at CPAC. They're all starting to roll together. It's been really action-packed. But Dr. Peter McCullough, you just arrived here. And
my name is John Leake. I'm an author. Dr. McCullough and I are writing a book together.
So exciting. And so you guys just got here today?
We just arrived last night, and we have an action-packed day. I'll be on the main stage just a few hours ahead of former President Trump.
Wow, what an honor. That's so great. You can see the line behind you. It's quite crazy here. So tell me about this book.
Well, John is an author, and he has an entire career track record in the area of criminal mystery and intrigue. So I'll let him.
Interesting. Okay, so how does that tie into this?
Well, I began to notice at the beginning of the pandemic, it seemed that early treatment was being suppressed. There was a sort of
demonization of it.
Exactly. The public was being discouraged from learning anything about it. Anything that seemed to show hope was being immediately suppressed. And I noticed that Dr. McCullough was sort of working on the front line as a doctor. So I contacted him and I said, what's going on with the suppression of early treatment? And he said, well, I have a story for you. So I just started writing it, and it'll come out on April the 15th.
Do we have a title for it yet?
The Courage to Face COVID.
Wow, that's really great. Awesome. So we've talked about kind of like people's journey in this. I noticed that in earlier interviews, you were still advocating for the vaccine in some circumstances. When did that change?
Efficacy has really dropped on the vaccines. Two things have happened. One, the virus is mutated, so the vaccines, through every successive mutation, have less of an effect. And the other thing we learned is the vaccines don't last very long. In fact, they have an expiration date as short as 3 months. A recent email I received today is that there's believe it or not, a healthcare facility that's now considering every 3-month injections to be extra short. And I just don't think people have an appetite for that.
Okay. And so it was really, as you learned more about the efficacy of it long term and some of the concerning data that started to change your mind about that.
Right, the safety data continued to mount in astronomical proportions. 2 weeks ago, I did my own direct query on VAERS in preparing for an ABC interview, and on the checkbox of death, that's submitted as, the submission for the VAERS entry, which we know is underreporting. The number is 12,670. That is far beyond anything that would be considered safe or reasonable in our society.
So about this book, what kind of books in the past have you done, and how different is this book than other things?
Well, I've done conventional true crime books and investigations of murder and missing persons, but both of the books that I've published so far have a medical component. I've spent a lot of time with forensic pathologists. So I was interested in the way medicine, a medical phenomenon, can be represented one way or the other to conceal things. And I was very interested in the book that came out last year, The Empire of Pain, about the Purdue Pharma and OxyContin, which was this very highly addictive substance that was being sold in America for years in spite of pretty obvious addiction and overdose and creating enormous social cost. And this wasn't really being acknowledged. It was sort of being swept under the rug. And so it's that kind of story, how something that, in this case, it could have helped being suppressed, early treatment, and then we come to the vaccine that's presented as undeniably helping, but in fact it has a risk that's being concealed, I would say. So you have both sides of this. On the one hand, early treatment is being suppressed, and then on the other hand, this mass vaccine mandate, risks are being concealed.
I mean, and that's been the crazy thing for me to observe as a journalist is when I ask certain doctors that are critical of any pushback on the vaccine, they're like, well, these early treatments, there's just not enough data. I mean, that's the kind of pushback I get. But what about the vaccine data? I mean, they're actively hiding the data, and in many cases it just wasn't right. So it's crazy to me.
Well, you hit the linkage. And when I went on with Tucker Carlson, now coming up on a year ago on his long program, I told Tucker it's linked. the people and the societies and the countries that say early treatments don't work or we shouldn't use them are the same exact stakeholders that are massively promoting the vaccines, what I call vaccine hubris. The moniker is a needle in every arm. It's the same people. Suppression of early treatment and over-exuberance, over-promotion, in my view, dangerous promotion of the vaccines. Every product has both risks and benefits, and they have to be fairly evaluated and updated. America has still not yet had a safety report on the vaccines.
It's so crazy. And then you have big tech in lockstep. I mean, so much suppression, censorship, and even attacking on people that are trying to just seek the truth. What kind of obstacles have you faced with this book in terms of, was there ever any concern that it would be suppressed or censored?
Well, Dr. McCullough can speak to his ongoing, he's
lawsuits and everything.
He's the one that's had to contend. I'm just telling the story. I've not received any kind of late night calls saying you ought to think about not doing that. But he really has had to contend with a lot of, well, can you talk about it? I don't know.
It was clear, actually, early in 2020, there were going to be headwinds on early treatment. I mean, research for early treatment, novel approaches, the attempts of doctors to try to help patients, that there was clearly censorship, there was pressure, coercion, the threat of reprisal. Don't do this. To the extent of the course of the people's lives being changed, losing their jobs, being ridiculed by colleagues. This is part of history. History repeats itself over and over again. The doctor who first put a patient on the iron lung in polio, which turned out to save a lot of patients, was thrown off medical staff. He was ridiculed. John has countless other examples.
Yeah, if you look at the history of medicine, there's numerous examples of a doctor who makes an observation, has an innovative idea for improving treatment, but if it's not in accordance with the prevailing orthodoxy of the day, he's actually been persecuted.
Well, I mean, the name escapes me, but there was, of course, the famous story of the doctor who saw a correlation between assisting with childbirth and washing hands before.
Dr. Semmelweis.
Thank you. It's hard for me to remember all these names. But yeah, I mean, he was ridiculed as well. Didn't he even end up in an insane asylum?
He did. So I actually lived in Vienna for many years, and I was interested in the Semmelweis story. I even sketched out a screenplay as sort of a drama of it. Yes, he was observed that a friend of his in anatomy class got cut by a scalpel and then became very, very ill and died. And then he realized in the maternity ward of the university clinic, women in childbed were having a sort of similar syndrome. So he had the brilliant idea, hey, maybe the anatomy students should wash their hands before they examine the women in the maternity clinic. And nowadays we think, well, I mean, of course, right? But back then, the state of medical knowledge, they
took it as an insult, which is what you see happening now.
But think about the parallelisms. The very first time I saw one of my senior patients get COVID, my initial instincts were, treat it now before it gets severe. Right now it's mild. They say, doctor, I just have a little congestion. I said, we can knock it out. The virus is replicating. It has not tipped off the sequence of inflammation and blood clotting yet. If we can knock it out early, we have a chance. And this is the same principles we use for all infections. In fact, community-acquired pneumonia, bacterial pneumonia, a metric is the time to the first administration of an antimicrobial. Why wouldn't we have the same for COVID?
Absolutely, it's crazy. And so right now you have a release date set for
April the 15th, which is, I realize after the fact that's tax day. Maybe we ought to change it to the 16th, no, April the 15th. Okay. Courage to Face COVID-19. It's available on Amazon and pre-release right now.
One more question, because it's funny. I've talked to Dr. Peter Breggin when he was writing his book, and others that have followed this in order to be able to write the books. And he was saying, like, up until the publishing date, I was having to add more information. And I mean, just the information keeps on dripping out. You just learn more every day. And so did you face anything like that where as you were like, oh shoot, I have even more information, I have more stuff I can put in?
Oh yeah. I mean,
all the time,
all
like
the time.
every day.
Every day. I mean, I think that breaking it down into really getting a grip on the suppression of early treatment, that's the first thing that we're establishing. And it's very clear. There was an orchestrated propaganda campaign to suppress early treatment. So I really go in and document that, but in a narrative way. I mean, it's following his adventures, he and his colleagues. So we see that early therapy was suppressed, and almost in the same compound sentence, there's the efficacy and safety of hydroxy and chloroquine and ivermectin is gravely, contested. However, we've got this vaccine coming, so stay tuned, folks, for the vaccine. So there is a link. We're starting with the suppression of early treatment, then we're going to examine the vaccine.
I imagine it's packed full of even more information, and we need that information to be armed with to resist those that are trying to push these things on us. So anything else I missed that you wanted to touch upon?
I think the real apex of where we are right now at that next inflection point that people need to look at and study very carefully was the U.S. Senate panel, a second opinion led by Senator Ron Johnson. I co-moderated the panel January 24th. Now, that's just about a month ago. Wow. 5 hours of truth bombs. And there are transcripts now. It's been translated. There's a condensed version of it. Had over a dozen doctors treating experience, thousands of peer-reviewed publications, vaccine scientists, nurses, patients, lawyers. And I have to tell you, that's it. It's in the Senate record. Historians will recall on this. Doctors came to Washington and gave our leaders a second opinion. The question is, none of them showed up in the room. The question is, did any of these government officials, did they listen at all?
Have you gotten any indication that second opinion had changed anyone's minds or had any effect on those that have just been the diehard? You have heard?
I think so. If you look at the series of events that's happened worldwide and with the CDC, mandates starting to crumble, restrictions starting to be dropped, the CDC floating out a little cartoon on their website saying, seek early treatment. Believe me, they've been buzzed. They've been buzzed, and they've been put on notice, whether they like it or not, and we had to do it. It's for the sake of Americans. Our seniors have been slaughtered by this virus. It was always a problem of senior citizens. The news cycle has been exclusively focused on young people and children for the last year. It is a problem of our senior citizens. And we emphasize, put the focus back on the people suffering with this illness. Let's save lives now.
Being that we're at CPAC and we're prepping for midterms and things like that, what are your concerns, either of you opinion-wise, that some of this pullback is just temporary appeasement to try and do better for them at the polls? I mean, you have Rochelle Walensky saying, we'll give them a break from the masks. I mean, is this break from the masks so that they can have protection with people's votes?
It's possible. I'm thinking that despite the tendency for doctors like myself to resist politics, it's always been said that when medicine and politics mix, what you get is politics. I think at this point in time, it's inevitable that the news cycle and the governmental operations for the last 2 years have been completely dominated by a medical problem. We must have medical issues come to the forefront. What we don't want is choreography. That is, we'll ease up a little bit and try to influence the elections, and then we're going to hammer back down at the next sign of an outbreak. We are past the emergency phase of this now. We have tremendous hospital capacity. We have an array of emergency use, authorized use drugs. Other drugs worked in combination. We are starting to see cracks in this wall that's occurring. And the wall was concerning because the wall represented a new way of thinking, a totalitarian way of thinking that was against the core principles of the life, liberty, and pursuit of happiness. What's at the principle here, and my message to the Republican Party, is that be the party of freedom. Be the party of medical freedom. Medical freedom is at the heart of our personal freedoms.
Something people on both sides of the aisle are asking for. I think that can actually be the one thing that really unifies people. He said choreography. I think that's a good way to say it. They've been performing this dance for us, and that's what your book is going to show. Can you tell me the name of your book again?
The Courage to Face COVID-19. Courage is a big ongoing theme. You see Dr. McCullough and his colleagues at the beginning of this saying there was a lot of uncertainty about the virus itself, about how dangerous it was, and they acted in the old school of medicine like we've got to treat it. I mean, we don't have perfect knowledge, but we have to do our best. And I mean, I think that's the theme of life. You can't always have a guarantee in advance that your endeavors are going to work, but you still do your best. And so that's what these guys did. And Dr. McCullough, what I really admire about him is, and this isn't, I'm not being flattering, he's a true scholar. He goes where the scholarship, where the truth leads. And if corporate compliance attorneys say, no, we don't want you to say that, he says, well, why not? It's the truth. So, courage and truth, and the American way.
I think that's a good way. Any final words?
That's it. The truth will come out.
Awesome. That's what we're hoping for. Thank you so much, both of you.
Thank you.
Thank you.
So nice to